Warning, please do not use or derive concepts from this video to try answering questions and incorporate into the steps of a diagnostic approach to a patient. This video is brought to you by Anemoma. Today I will be discussing Spider-Man. So it can be presumed that he excretes a large amount of fluid in order to perform the physical feats that he does. Many arachnoids possess adhesive pads on their feet that help them climb smooth surfaces. Spider adhesives have converged on a branched, hairy structure which theoretically allows them to adhere solely by dry intermolecular interactions, but for the most part they use wet intermolecular interactions. And since he will be excreting a large amounts of fluid, the amount of sweating he does will be increased as well. But his body probably has a mechanism which adapts to sweating in a more efficient manner to increase his stamina even more. And since he is losing a lot of fluid, he will need a increased amount of water intake in order to replenish those fluids. And there's a higher chance of him developing pimples due to the fact that he is excreting more amounts of fluid, and there's an increased chance of a duct being blocked and increased amounts of fluid building up behind that duct. And another reason why he has an increased chance of pimples or acne is because the fluid probably mixes in with the proteins required to make the webs, which will cause the fluid to be sticky. So this increases the chance of a duct being blocked. And when he's swinging from building to building, there's a chance that testicular torsion will occur. And this usually presents with a sudden onset of pain and is a surgical emergency. You have to differentiate this from epididymitis and a hydrocele. Epididymitis usually has a positive Pren maneuver, which just means that when you elevate the testicle, there'll be a relief of pain with epididymitis, but this will not occur in testicular torsion and will actually make the pain even worse. And then for a hydrocele, that's just a buildup of fluid in the testicles. And usually in an infant, it's due to a patent processus vaginalis, but in an adult, it's usually due to an imbalance between the secretion and absorption of fluid in the testicles. And since he's secreting more fluid, he will probably have a higher chance of a hydrocele. There's a good chance that he'll have a protein deficiency if he excessively uses the proteins to make webs. This is because the webs require protein and can cause protein deficiency. And since he's swinging from building to building and is at a high altitude throughout the day, there's an increased chance he'll have skin cancer due to the exposure of UV radiation. And so you may want to screen him for skin cancer constantly. And another thing to watch out for him, if you know he has a increased risk of skin cancer, you should test him for genetic causes such as eczeroderma pigmentosa, which is a genetic defect in nucleotide excision repair, which is due to the formation of thymidine dimers upon exposure to UV light, which can cause skin issues upon exposure to minimal UV light. And usually the mortality rate for people with eczeroderma pigmentosa is 40 years of age, but if they present with neurological symptoms, it's usually 30 years of age. And you may want to avoid to screen for other diseases that cause photosensitivity, such as porphyria cutanea tarda and SLE. And you should avoid drugs that cause photosensitivity, such as sulfonamides, amiodarone, tetracyclines, and fluoroquinolones, and many other drugs. So next I'm going to talk about the spider's web, which is a protein fiber. The major amino acids in the silk proteins are alanine and glycine. Serine and praline are also present in significant quantities in some types of silk. Glycine-rich regions give spider silk its elasticity, forming aphorous areas in its structure. Alanine-rich regions link together through hydrogen bonds to form crystalline areas that give spider silk its strength. My theory is that it is similar to collagen synthesis in humans, but rather than glycine being the predominant amino acid, it's alanine. So next I'm going to be talking about the anatomy of the webbed ducts. So there's my theory is like, if this is the arm, it can be composed of one duct and drain here, or it can be multiple ducts in the dermis and it kind of has a web of webbed ducts, so like that. Or it can be a sheath that just circumferentially surrounds the whole arm. And usually in order to prevent obstruction, it'll come up as the skin regenerates, the web fluid will also be excreted from the body as well. or it travels to the rest of the body through the bloodstream, and the proteins are broken down and reused somewhere else in the body. And one way to avoid duct blockage is through the mechanism of how you would treat maybe a lymphatic obstruction. You can do a lymphatic venous bypass as shown here, where you can combine the web ducts into the veins so they can be broken down. They can break down the protein and then be used by the rest of the body, or you can put in a metal stent covered in chemotherapy agents and prevent the proteins from forming and decreasing the chances of the web building up and causing an obstruction. And you would have to replace this metal stent every few years or so. So the treatment plan would be to decrease the secretions by giving anticholinergics if he's secreting too much, and this may help with blockage issues, but if he's not secreting enough for the upkeep of the webs, you may want to give him cholinergics to help with secretion. And he should wear sunscreen with UV protective clothing and sunglasses at all times. And since the prostate is a secreting gland, there's a higher chance that he has BPH, and you may want to start him on finasteride therapy at a young age just to prevent the rapid growth of the prostate. And you may want to do a digital rectal exam every year just to screen for prostate cancer, even though in normal society you don't screen for prostate cancer or BPH until symptoms present. And he should avoid tight clothing to prevent the compression of the web ducts to prevent an obstruction from occurring. He should also go on vitamin C and protein supplements because these will be decreased due to the excessive production of webs. All right, thank you for watching.